As a behavioral health provider, you play an important role in the postvention process through all phases, including outreach, assessment, treatment, and recovery support. This is intended to be a helpful guide for you when you're involved in postvention. Engage in outreach. After a suicide, family and community members are likely to be too upset to access services on their own. It's important for community behavioral health providers to reach out to survivors of a loss to suicide and to inform them of the services available and how to access them. By coordinating with local health providers, teachers, employers, family members, friends, and spiritual leaders, behavioral health providers become part of an important network of support. This network can stay in touch with those affected by the suicide and make sure they know they're supported. Become a gatekeeper. In addition to the survivors of a loss to suicide, there might be other emotionally vulnerable people in the community who are now at increased risk of suicide. This is an especially important time to be vigilant and watch for warning signs of suicide among family, friends, and neighbors, and be available to provide behavioral health treatment services to reduce the possibility of suicide contagion. Train gatekeepers who have received training on how to recognize warning signs and how to connect people with help, as well as individuals who are informally connected to people who may be at risk, can help watch out for those who are struggling. You might want to reach out to both sets of people and ask them for assistance in keeping an eye out for anyone having a hard time. Take care. Providing care in the aftermath of a suicide can be a complex job. It can also be stressful and emotionally draining. Don't be afraid to talk with colleagues and learn from each other's experiences. Coping. Survivors of a loss to suicide often focus on finding answers, causes, people, or things to blame for the suicide. Dwelling on how or why the suicide occurred could increase emotional distress and risk for depression. Ways of coping with a loss to suicide are important to the provider and to the survivors. Safe messaging. Community members may sensationalize or glorify the suicide. It is possible that inaccurate information and rumors might spread through the community. Special attention must be paid to ensure that public information follows safe messaging guidelines. Suicide is a complex phenomenon, so it's important to talk to people about suicide in clear and simple terms. Educate them about the fact that suicide is often the result of a serious mental health problems, but be careful to note that sometimes people choose to attempt suicide because of circumstances and life experiences that we do not always understand. Debriefing. The community may require time to debrief after suicide. Behavioral health providers are an ideal resource for this process and can ensure that individuals who are especially troubled access the appropriate treatment and support. Partnering with youth organizations, communities of faith, and other civic organizations to offer talking circles, which are safe places to talk and ask questions, helps make sure that people in need of behavioral health services after a suicide know whom to go to and how to access services. Asking the state for help with a local behavioral health emergency. The State Division of Behavioral Health relies on local community behavioral health centers to provide the first behavioral health response to any local emergency or disaster. If a local center is overwhelmed by an event, the center can request state assistance directly from the division. Please refer to the Postvention Guide, Community Behavioral Health Providers chapter for the contact information. In the request, the center will give the division's program manager a written or oral report about the cause for the request. Asking the Indian Health Service for help with a local behavioral health emergency. The Indian Health Service, IHS, has designed an emergency response model for helping American Indian and Alaska Native communities when tragedy strikes. Through the IHS, communities can request help from the U.S. Public Health Service. The goal is to help the community reduce the impact of the immediate crisis and to stabilize members so that they can begin to develop long-term solutions such as planning, prevention, and implementation plans. This contact information can be found in the Postvention Guide, Postvention Planning Next Steps chapter. There might also be community members with special needs due to mental illness or addiction problems. Please refer to the Substance Abuse and Mental Health Services Administration practice guidelines on responding to mental health crises in the Community Behavioral Health Providers chapter in the Postvention Guide. You'll find resources for information and action plans in this section of the guide.